Namaskarams Masters. Namaskarams Master E.K. Om Gam Ganapataye Namaha. Jnananandamayam Devam Nirmala Spatikakritim Adharam Sarvavidyanam Hayagriva Upasmahe. Om Dam Dhanvantaraye Namaha. All the spiritual peoples of world, at the same time, the World Pharmacist Day. The days are not a special occasion, but a special occasion was made for every profession in this world. The days are 365 a year, but occasions are more than that shortly. So every occasion is a revising phenomena of the profession standards and living standards and their motivity in the public. So like that, the Pharmacist Day also on behalf of the health of the public. Though pharmacy is the main among the people, the world, every year on September 25th, usually this World Pharmacist Day will be celebrated. So this was a practice since 2009, and several important factors are celebrated in this by keeping the motivity of the pharmacists and the withstanding of the pharmacy among the public health, what they are doing. But the slogans are very, very, very common. But this pharmacy is the profession which is mostly arising from the UK and the USA. The remaining parts of the world is the traditional methodology is more up to 1960s and 70s. Later the profession has changed into its shape and color and etc. etc. So always trusted for your health is the first, that is 2021 slogan. And the important factor of this is the important factor among this is mainly always showcase the theme before the discussing about the theme. Showcase pharmaceuticals in creating a positive change. That is the first part in the world, and further strengthen the unity among the people in the profession. These two are, the first one is the given to the public, showcase pharmacists in creating a positive change. Showcase means, what is meant by showcase? What is the meaning behind that? I could not understand. But anyhow, the pharmacist has been a man who has been kept in the showcase by keeping the drugs, etc. But at the same time, further he has to strengthen the unity among the people in the profession. This is the right way. Unity among the profession means what the profession is bifurcated to several lines. One is the education, and another is the industry, and third is the hospital pharmacy, and now it is the clinical pharmacy. There are 4 or 5 different routes are designed for the pharmacy, and these are, all the routes has to connect with the medical profession. Ultimately, the public health is the outcome of the public health is the main importance. So 2022 slogan is Pharmacy United in Action for Healthy World. No doubt about this. Healthy world is the healthy world. World is always changes. Health also changes. People changes. How we will get? But healthy world is not with the drugs. The healthy composition of the environment should be created, and for that environment everybody has to cooperate, not only the pharmacist but also all the professions. As a human being, unless and until the environment has been cleared for the health scenario, until that health is a ambiguous, it is not a substance, ambiguous phenomena of each individual to the group level. So 21, the pharmacy trusted always, pharmacy trusted for your health. Trust the pharmacist. That is the 2021 slogan. But patient health is the key part. But who is a patient? Only the patient played a vital role, at the same time opposite to the professional. So in this means, who is the patient? How can we call the patient? Only the public alone. In the public, the professionals won't come. So every professional, so ultimately after corona, what has become a patient is a variety patient. Variety patient in every profession has become a variety patient. It's the outcome of the variety patients. Only public, no professionals means all professionals are become somewhat the health is deteriorating in certain concepts, diabetes and heart complaints and kidney troubles, etc., etc. Ultimately, psychosomatic diseases. And post-COVID scenario also was not assessed properly. And later, everybody, every country, every profession has looked after post-COVID session into their economic standards only they want to improve. At the same time, what is behind their health was ignored personally and at the group level. So this is the response. So the public health was why it is ignored. Nobody will be assessed. Only the slogans were imparted every year among the public. So for the pharmacy profession has linked with two other important factors. One is with the patient, another with the physician. So this is a PQ phenomena. If you take this three piece as a triangle, and the formal triangle is a scalene or the isosceles or whatever it might be. Based on that, the center core is the drug, and outcome is this circle within and outside circle. These two circles have a relationship of the health. So who will explain this appropriately for the professions and professionalists and also the to the public. So curing the disease, what is the role of the pharmacist, what is the role of the physician, what is the individual role to have a health of the health by the patient. Patient's role is also very key part. So that is only with the proper appropriate education, educational standards, health education. And this is, apart from that, we have to think the two important factors I wish to put before this world. Already this number phenomena is collected from the Google search. And the period of time, the number of pharmacists increased day to day and its impact. So once upon a time, that is during the 60s, the female pharmacists are very, very less. Now the female community has entered for the past 30 years, and the growth of the female pharmacist education and also coming into the profession is increased enormously, 14% in 1960, mid 1960, and now it is raised to 60 to 65% or more than that. More than that. It means the pharmacy profession is definitely and surely into the women's hands. But how far this women community will withstand for the pressures and also to give the, first of all, they have to secure their own health. First of all, they have to be health, because the motherly nature is a very key important role for the generation to generation and genetical effect, etc. So these are all to be considered by the women community about the drug and the health scenario. And another important standards of living of pharmacists is, as per the American standards, The annual income of the pharmacist only 50% of the doctor's income in the America. So what about the other countries? We can say definitely it is a low standard. So how can a pharmacist will compete with the doctor? Once competition is not for the quarrel, is not for a professional competence. Professional competence. The pharmacy standards are below the level of the high, almost less than the 50%. How it will be increases? So this is a big question mark before the pharmacy profession. Before and how simply blaming the medical professionals and medical profession, it is not good. So we have to educate ourselves appropriately, and we have to educate the public appropriately. Then only it will be possible. First of all, the pharma professionals has to come forward with a great sincerity or good sincerity, dedication to go in a right direction. Right direction is the important factor. So we are going into the wrong direction. Who told you the wrong direction? If anybody questions, first of all, every professionalist has to think himself in which direction he is going. So there are several other questions will be raised in this concern, but all questions are belongs not only the professional pharmacy, but also allied other professions also. The world pharmacist is entirely because the thing is education and the professional scenario. These are all depends on other factors also. When the disease and health is depends on the geographical phenomena, why not the individual standards of the profession also depends on the geographical phenomena. At the same time, a constitutional legislature, these are all comes under into this factor. All these factors are to be considered. So in the work arena of the pharmacist, so nobody knows. The Indian pharmacist knows certain things. He has to work at America, suppose. He lives for their constitution, but he cannot provide to the Indian scenario how much delivery of the words and etc. The subject which is been delivered in India. If he comes, whatever he delivers, how far it is relevant to the Indian public or Indian health or Indian drug or Indian function of the drug, in function of the Indian drugs or the any kind of drug. So this geographical variation should be understood properly by the all professions of the world, all professions of the world. Health, so it means the how far it is true and how can we cope up with these differences and similarities in the environmental factors, etc. should be understood. And the hospital pharmacy is the key factor in this, and which environment and also the other factors which cannot be dealt here. So finally, education is the main route to destiny of the success of a profession. It is postulated in our hands, but since thinking otherwise, pharmacists will withstand before the public as a personal for the. He should not be. Suppose if he going on like this, what will happen? The pharmacist will be shown by the other professions. A pharmacist is the culprit before for the public health. So he has to. She will be a anti-socio health conditions, anti-social health conditions. The drug will be the right reason, but nobody will understand who is the drug promoter in this world, the physician, doctor, etc. So drug can be invented or discovered, whatever it may be word, we can use it. The drug should be understood not only by the pharmacist, but also by the physician, and also other factors also involved in the different professions which are coordinated with this health. Apart from that, the patient is the key personality to have the drug. Before that, he has to understand what is the impact of the microorganisms, specifically the bacterial strength, and whether we have to go with the parasitic nature of the bacteria or we have to go with the symbiotic nature of the bacteria, which has to be agreed by all the people. That is the key concept for health, because trillions of number of trillions of bacteria is the pool surrounding the human cell scenario. So who will be the responsible? How to understand this bacteria is a big question mark. Even though we have invented so many antibiotics, etc., and others which can be ruined, those inventions are ruined the public health, or they have the bacteria has respected the antibiotics or respected the human being. So who will knows? Only the time and tide wait for none. For the same in the case of the public health. Thank you one and all. Kindly think about this, and loka samasta sukhino bhavantu. Om shanti shanti shanti.